So today we will discuss about neurocystic sarcosis, and it is a high topic, and then mostly the MCQs are asked from this topic, that is neurocystic sarcosis. So first, it is a most common parasitic CNS infection of the man. So second point, it is the most common cause of adult onset epilepsy in the world. And second, you want to remember the most common site is subarachnoid space and followed by parenchyma. Okay. So these are the 3 points you want to remember first. Second, coming for the clinical manifestation, the seizures, it is the most common manifestation. And second, so coming for late onset epilepsy, it accounts for only 50% of the cases. Okay. But the most common presentation is seizures. And what are the other features you can see here is hydrocephalus, hypertension and psychotic disturbances. So here remember H. So hydrocephalus and then hypertension, that is intracranial hypertension, and some psychiatric disturbances like hallucinations will be there. So coming for morphological stages, just remember 4 stages: vesicular, necrotic, nodular and calcified stages. So coming for clinical features, it usually depends upon the presence of cyst and what is the location of the cyst and where it is located. Okay. So first is how many cysts, and then what is the location, whether it is in parenchymal or extraparenchymal. And coming for size, usually there will be a small cyst in case of cellulose, that is in cystic cercus cellulose, whereas big cyst will be present in cystic cercus racemosus. And then morphological stage, we discussed already, like vesicular, nodular and then calcified. So the clinical features depend upon the morphological stages also, and depend upon the host immune response. Okay, if the patient is having the well developed immune system, then probably he will be having less clinical features. If he is immunocompromised or immunosuppressed, then there will be the clinical features will be very severe and it will be very worsen. So already we discussed the most common clinical feature here is, that is the symptom is seizures. Okay. So coming for lab diagnosis, in microbiology, you know only there is an antigen detection and antibody detection. So here the antibody detection is by ELISA and the Western blot, and then you can detect the cyst by CT and MRI. So CT scan is usually for calcified cyst. Okay, just remember C for C. Okay, CT for calcified cyst and MRI for extraparenchymal cyst, that is usually in the verticals and cisterns, and you can make out any inflammatory changes, vesicular changes, necrotic and non-cystic. So only in CT scan you can make out calcified, that is C for C. Rest all changes we will be seeing under the MRI. And then there is a criteria for Del Brutus criteria. If you remember the name, that's enough. Okay, no need to read the details of the criteria. So okay, so next is a treatment. As usual, it is an albendazole and praziquantel, and surgery if there is for any ocular or spinal or ventricular lesions. Okay, so just a take home messages. So it's the most common parasitic infection of the CNS. Second is most common presentation here is seizures, and there is 4 morphological changes, and then CT is for calcified cyst and MRI for the other changes, that is an extraparenchymal and then nodular, or that is a necrotic, you can make out in the MRI. And treatment, you know, albendazole, praziquantel and surgery. So don't miss any point in this neurocystic sarcosis, because each and every point is very important for the MCQs. Thank you.